I'm here today to talk to you a little bit about nullification and interposition in the 10th Amendment, and specifically as they apply to stopping Obamacare at the state level.
Yeah.
I got a lot of information to throw at you, so we're going to run through it as quick as we can. But what I'm here to tell you today is that stopping Obamacare at the state level is a three-step process. You have to return, refuse, and nullify, and I'll expand on that real briefly. The way that Obama is planning to set up and run Obamacare in the states is through a series of healthcare exchanges, which are online shopping centers where you can pick among your choice of government-subsidized health insurance plans to buy online. The way that he's going to implement these is by giving states federal startup money, which is what I refer to as bribe money, to get these going, and then have the states run them and take on the expenses, which means that you take on the expenses for running something that he came up with. Now, back in November, Bev Perdue, when faced with a choice of saying either we're going to take a state-run exchange, a state-federal hybrid exchange, which basically means that the state pays the bills and the federal government tells them what to do, or opting out and saying we don't want anything to do with this. Well, she chose the middle road and accepted $73.5 million in bribe money from Barack Obama to institute a state-federal hybrid exchange here in North Carolina. Boo indeed. But North Carolina was in a unique position because she was a outgoing lame duck governor. And she knew that there was an incoming Republican governor and an incoming Republican supermajority in the General Assembly and an incoming Republican majority on the state Supreme Court. Republicans control all three branches of government in North Carolina for the first time in history. And so we have a historic opportunity to take what she did and say, you know what? Not this time. So the reason that we can do that is because conservative policy analysts found a line in the healthcare ruling passed by the Supreme Court that said that Obamacare was constitutional as a tax. But what it said, and in the fine print it says the legitimacy of Congress's exercise of that spending power rests on whether the state voluntarily and knowingly accepts the terms of the contract. What that means is these mandates that they keep telling us we have to follow, we only have to follow if we agree to follow them, because we still live in a free country, regardless of what the people in Washington think. So, to turn this around and make North Carolina first in freedom as well as first in flight, we have to do three things. Number one, Pat McCrory and the General Assembly have to return that $73.5 million in bribe money that Bev Perdue accepted and say, you know what? Keep your money. We don't want any part of this monstrosity. Second, Pat McCrory and the General Assembly must refuse to accept any federal money to expand Medicaid in North Carolina. The Medicaid expansion is one of the key planks of the Obamacare law that obligates North Carolina to follow so many of the purchase mandates and obligates North Carolina employers to go into the coverage mandates. But most importantly, so that's step one, return the Obamacare bribe money. Step two, refuse the Medicaid expansion money. But the most important is step three. If we do steps 1 and 2 and nothing else, we still fall under a mandate from the federal government to impose a federal-run healthcare exchange on all the states that don't go along, and that includes North Carolina. The way to get out of that is to fall back on our Constitution, the legacy left to us by our founding fathers, and on the basis of the 10th Amendment, nullify any federal healthcare law that is imposed on North Carolina and interpose criminal penalties on any state or federal official attempting to impose a healthcare mandate in violation of that law. Here's the thing about this step 3. When they passed Obamacare, they were not counting on most of the states opting out of the state federal hybrid exchanges. They assumed that our elected officials at the state level all across the country would not be able to turn down free money. But most of the Republican governors in the country, to their credit, have done so, including all of the states around North Carolina. South Carolina, Tennessee, Virginia, Georgia, all of their Republican governors have said thanks but no thanks. Money was not appropriated when Obamacare was passed to operate federal-run exchanges in all of the states. Now they don't know what to do. They're saying that they can go along with it and just run it just fine, but they're bluffing. We have to call that bluff. A federal, and here's the key part. In the law, a federal exchange is barred from offering tax credits to subsidize premiums. So all of the subsidies and the mandates that go with them go away under a federal exchange. They're hoping you don't know that. Under the state exchange, the IRS pays the credits directly to insurers and to cover eligible individuals and their families who buy their health plans on the exchange. But the subsidies based on income, and insured participants pay the difference between the subsidy and the premium costs. So under the mandate, most employers with 50 employees would be required to provide federally approved health insurance or pay $2,000 tax per uninsured worker, with exclusions for the first 30 employees. But because the federal exchanges are not authorized to issue those credits, employers couldn't be assessed the $2,000 tax to fund them. It's illegal. So states that opt out of the federal exchanges could then find themselves in the position to being able to lure companies to relocate from states who accept the exchanges. And the lower tax environment would be more conducive to job growth for existing firms. We could become an economic powerhouse by telling Obama to go soak his head and keep his damn law. Yeah! The state of Oklahoma has refused to set up a state exchange and has filed a legal challenge to the federal exchange saying, you're saying we have to accept a federal exchange, but you can't even provide the subsidies under the law that you say you will to run it. This is going to the Supreme Court, I believe, and regardless of whether it rises or falls, states that don't create their exchanges would still have the nuclear option of delicensing any health plan sold through the federal exchanges and collect the federal subsidies or tax revenue for their own budgets. That would, in effect, completely block a federal exchange from operating. Pat McCrory and the General Assembly have a multitude of methods that they could use, but the most important is to stand up against the federal exchange and refuse all three. It's time for us to stop being afraid of Washington. Our founders did not create a republic with states that were merely marks on a map that were just provinces for Washington to rule over like some kind of king and everything but name. There's no reason to pander to the socialists and the Marxists in North Carolina anymore to get things done. If Republicans cannot agree to do everything possible to stop Obamacare, well, what the hell's the point of working so hard to elect him in the first place?
Exactly.
I need everybody at this rally and everyone who watches this video to call up Pat McCrory, to call up Tom Tillis, Skip Stam, and Phil Berger, and say, give one message: honor your oaths and nullify now.
Yeah!